So can we just start by you telling me your name, your medical specialty, and where you work, please?
So I'm John Crichton. I'm a forensic psychiatrist, and I'm currently working with 50 high-risk forensic mental health patients in the community in Edinburgh.
So could you talk a little bit about how coronavirus has impacted on your working hours and your practices? We talked about that 6 months ago, and I wondered, have there been any changes since?
Well, 6 months ago, we were hoping to get back to a greater sort of normal working pattern. Before COVID, I had special responsibility for female patients, and I would see them through from perhaps somebody being involved in a court process or being in prison to sometimes quite a lengthy period of time in secure inpatient care, and then following that person up in the longer term in the community. With COVID, infection control measures came in, and so we were siloed off into psychiatrists being based on one ward or another ward. And because of my age and health, it was seen that I would be a good person to remotely support the community patients, most of which were new to me. I knew of them, but had not been their doctor. 6 months ago, we were very much hoping to get back to our normal way of working in January 2021, and our plans for that return to a normal way of working were live up until really mid-December. And the second wave at that point seemed to be abating. We had been given the green light for some relaxation over Christmas, particularly down south. And then the Kent variant meant that this second wave had this dramatic second hump. And as we went back into a stricter lockdown in January, we simply continued the arrangement of sole community working, and that's where we are today, towards the end of April 2021, and our plan is to continue that way of working until August of this year. So in August, we're planning to go back to the way that we worked before.
Thank you. So another thing that we talked about 6 months ago was what you thought the long-term, both physical and mental health impacts of COVID were going to be. And I just wondered, do you have any sort of new perspective on that?
I think that my early thinking on what's become known now as long COVID has really been confirmed. And I think that long COVID is going to be this catch-all phrase for a variety of different neuropsychiatric presentations. And the difficulty with that type of presentation is that there's a tension between the psychological and the purely biological. Inevitably, successful management strategies will need to combine the two, but I suspect there will be great arguments going on for years and years, in just the same way that there were arguments about chronic fatigue or Gulf War syndrome. And it's simply in the nature of the condition that people don't like a tension between psychological influences and physical influences in conditions such as this.
Thank you very much. So another aspect of sort of the long-term changes that we talked about was the impact on medical practices and the running of the NHS. And so do you think COVID will have any sort of long-term changes in the way you treat your patients or the way the NHS operates?
I think we've seen a complete change in our approach to remote technology, and I think that remote technology will have a far greater prominence in the future. So I suspect there'll be a lot more hybrid communication. I'm just going back to face-to-face outpatient clinics in May 2021, but already, and it seems bizarre now to think of it, but we had I had no mobile phone provided by the hospital. I now have that piece of kit, and in the way that the community psychiatric nurses would text patients, I now text patients, and that provides an alternative and immediate form of support and assistance, which I think is going to be really valuable. I think that organizationally, a lot has been learned, particularly from government having a more directive role in the pandemic. Many of the weaknesses and strengths of the NHS have been exposed, and I think that will influence how government interacts with health boards in the future. And I think the other big area is waiting lists. The waiting list challenge is so profound, not only in mental health, but in other specialties as well, that we really need to rethink what we do about waiting lists, and think more in terms of graduated management strategies, whereby instead of primary care referring somebody and that person waiting in a rather sterile way before they may be assessed in secondary care, that appropriate investigations and treatment strategies that may be helpful to certain individuals might be started before a specialist is seen.
Thank you very much. So another thing that we talked about 6 months ago was the government's response to COVID. And I wondered if you had any thoughts about how the government actions over the last 6 months.
I think that overall their actions have continued to be reasonably sound. A very interesting period of time was between Christmas and New Year, 2020 going into 2021. And there, I think for the first time during the crisis, I felt that there was a bit of an air of panic. Some decisions were being made really quite hastily, and without the careful consideration that we'd seen beforehand. Now that might be, and I think it's easy to see why. Partly, a lot of the civil servants who would normally be work were on leave, and yet by that point in time, it was apparent that the Kent variant was going to have a very profound effect on infection rates and death rates.
Thank you. So following on from that, I wondered if you had any thoughts about the public's response to coronavirus, and particularly how that's changed over the last 6 months. Well,
although the lockdown in January was really almost as tight as the original lockdown at the end of March, it was really apparent from the very beginning that if your only indices was cars on the road, there were far more cars on the road in January and February than there were last April, May. And I think the public, I think one of the changes of the public was that at the beginning of the pandemic, this realization that it was the older age range, in particular vulnerabilities, that was associated with really bad outcomes. That wasn't fully appreciated at the beginning, and everyone felt more equally a serious risk. And I think that affected conducts and behaviors. By January, February, people were very much more comfortable with what exceptions applied to them in terms of justifiable trips, the use of bubbles, what could be considered essential, and all of those factors came together to mean that things looked much busier.
Thank you. So the biggest change really since I spoke to you last 6 months ago is the availability now of vaccines. And I'm interested to know, firstly, has that impacted on your work particularly? And also, do you have any wider comments about the rollout of the vaccines, how that's been handled?
Well, it's hard to describe the utter excitement and joy of getting that first COVID vaccine. Already we're becoming a little bit blasé now that 30+ million people in the country have had their first dose of vaccine. But rolling back to the end of November, beginning of December 2020, it was really quite a big thing. The first thing to say was that there were lots of problems in the administration of the vaccine to begin with. So the NHS telephone lines that you had to ring, initially you were put on hold for up to 3 hours to try and get through. And almost on a day-by-day basis, that was getting slowly better as people were coming on through. But the irony was that people who were working from their desks were more likely to get the first lots of vaccine than the people working in red zones, which didn't seem right at all. It also felt, working in the NHS, that the priority of NHS workers was a just and right thing for what everyone had gone through before. And that's why I think that the delay in the second dose, which was announced at the end of December, it really hadn't been thought through in terms of the effects on morale of health workers. It was justifiable, given both the science and the extraordinary rise of infections from the Kent variant, but that wasn't communicated particularly well, and there was also resultant chaos in the clinics, and so people were getting cancellation appointments for their second dose of vaccine, but then being phoned up to tell, well, just come anyway, because we haven't been able to fill those vacant spots yet. And so I was one of the lucky few to get the second dose vaccine at the appointed time, simply because I was in the hospital and they had 200 doses of vaccine to give, and the emails went out and people came. The vaccine clinics took the point of view was that they weren't going to let one shot of the vaccine go to waste, and they would go out and get people who would benefit from it to make sure that every bit of it was used. Now that's going back to sort of January, February time, as we saw that even with the Pfizer, a single dose was pretty effective. People relaxed, and as we saw the wider population roll out of the vaccine, again, people are much more relaxed about it. I think that the anxiety now is, if a variant emerges which the available vaccines doesn't cover. And I suspect we will continue to have anxiety about that all summer. I think we're going to have another wave, late summer, early autumn, but whether that wave is associated with hospital admissions is going to be really interesting to see. And I'm sure that we will all be having boosters towards the end of this year.
Thank you very much. So the next questions I'm going to ask are more about your personal experiences, and if there is anything that you're not comfortable answering, then please just feel free to say. So without naming individuals, since our last meeting, has anyone from your family or friends or colleagues contracted coronavirus? And if you're comfortable talking about it, could you elaborate?
I haven't had any further colleagues contract coronavirus. Certainly within our kind of circle of contacts, there have been individuals, but nobody that I've been directly working with. My home base is a medium secure unit, and we had. And within the secure estate, there had been a couple of deaths during the first wave, and we actually had 3 deaths in the second wave. But we managed to maintain the unit I work in as COVID-free, and we were really pleased about that. Whether that was simply down to luck or the planning and measures that we had in place, perhaps a bit of a combination of the two. I've had another family death. COVID isn't on the death certificate, but you wonder whether it was contributory. And of course, that's my second sort of close family death. And those restrictions on funerals are pretty sad and are tricky. I'm particularly pleased, however, that I'm back to having in-room, face-to-face with cuddles visits to my 95-year-old mother, who I see regularly. And that's ever so much better than window visits or telephone calls. Although somebody that I work with very closely, her mum, who's in a care home, she was just about to get the vaccine, and somebody else in the care home was positive for coronavirus, which meant that nobody in the care home got it. And that individual sadly died.
Thank you. So you've touched on this already, but I wondered if you had anything else to say about how your home life, your routines are continuing to be affected by COVID?
Well, I was working out, I think, in the outhouse, perhaps the last time we spoke, in an unrelated incident that flooded last August. So I've got a very good functioning home office that I can work out of here. But for the last couple of months, I've been going in mostly to the NHS base, partly because the IT is slightly better, but also to have a little bit more, if you like, water cooler moments with my community team colleagues to maintain their support. I would say that there's nothing easier about the second wave than the first wave. And in some ways, people have struggled more. Why they've struggled more, I'm not so sure about. It may be as simple as that we've had really grotty weather. And so during the first wave, we could get out and enjoy the sunshine. during the second wave, we would be stuck indoors and it would be blowing a gale, and all the novelty, none of the novelty was there anymore, and we'd watched all the films and the box sets and things of that sort. I think there must have been a national clear out, because wherever we pass the recycling centres, we see long queues. We passed a recycling centre where the police were having to marshal traffic the other weekend. But it's, you know, we sometimes joke that we're going, you know, we're lucky to be able to have coffee with our colleagues, albeit socially distanced, and go to the best restaurant in Edinburgh, albeit that's the work canteen, with about 3 tables spaced in a large hall, whilst we enjoy our you know, Scotch pie and chips.
Thank you very much. So something else that we talked about 6 months ago was the mental health sort of support for medical practitioners. And I wondered if over the last 6 months the support provided has changed in any way, has developed at all?
Yeah, I think there's been a huge shift in that. So we, in my other role as chair of the Royal College of Psychiatrists in Scotland, we'd campaigned for about 10 years for a physician health service. And there's been one in operation in London for a number of years, led by Dame Claire Gerarda. And they had expanded to the whole of England. And we had been in discussion before the pandemic about something similar in Scotland. That was taken on board and expanded to the whole of health and social care staff. So there's a recognition of the particular strain and stress that health and social care staff are exposed to, and remedies are beginning to be generated. I think more fundamentally, though, there needs to be a change in the attitude towards staff by employers to improve work settings and so on. And I think particularly for doctors, who are seen as perhaps a little elite, but really for all health staff, there's been an attitude in the last few years of, well, we can't be seen to be doing anything special for them. And we've seen, as money's been tight, all sorts of social rooms, educational rooms, libraries closed. And even before the pandemic, reflected in GMC surveys and NHS Scotland surveys, lots of concern about well-being and so on within the workforce. I think this is now being taken really seriously by government, and that well-being of NHS staff is being seen as a real priority, both in terms of retention and also making posts attractive for people to come to. So we've seen a really interesting thing with our fill rate of trainee posts. So across the board, trainee posts have been filled in every specialty, largely because the young doctors are not going off to have a year's break or to work abroad, because those opportunities have been closed off. But the real challenge will be to see whether they remain in training posts in 3 years' time, or take the opportunity then to take a youthful sabbatical.
Thank you. So my last question is around sort of sharing information about the pandemic. This is something we talked about before, about how information is shared online, including social media, and the potential for misinformation to be shared. And I was wondering, do you think that has improved or got worse over the last 6 months?
I think that it's changed its spots, and that the major source or topic of misinformation is to do with the vaccine, and some of it is sort of just malicious nonsense, and other aspects of it are the rumor mill. But you know, it's trying to differentiate between that population of people who would be suspicious about anything, who would not engage in vaccination programs normally, from that group of people who have legitimate concerns. And of course, we've had the clotting concern about AstraZeneca, and you know what is fueling all of that, and I think there will be lessons and books written about how different vaccines were viewed in different countries, different regulatory decisions, and how a regulatory decision or uncertainty then affects the overall confidence in a vaccination program. My anxiety in January was that particularly the 3-month delay between the first and second Pfizer vaccine would have a negative effect on integrity of the program. Now that hasn't been borne out as far as I can see. What it does do is it really highlights a feature of social media, and you can see it on the social media feeds, saying that, you know, are you happy you're not spreading false rumors? Are you going to the authorized sites and things of that sort? But a facet of our modern social media age is that no matter how extreme an idea or view you might happen to have, you're going to find other people to reinforce that. Now, that's as true for people who might follow a flat earth creed as it is for people who think that there's some nefarious intention behind the vaccination program.
Thank you very much. So before we finish, is there anything that you'd like to say that you haven't had the opportunity to bring up already?
No, I don't think so. I think we're caught at a very exciting moment. We're looking forward to cafes and hospitality reopening next week, so we're all feeling quite cheerful. One of my patients said to me yesterday that they were really anxious about a third wave, and I remember thinking before the second wave came, and the restrictions associated with it, that we perhaps would avoid that. And I was in contact with friends in Melbourne who were going through a second period of lockdown, commenting that I wasn't sure I could do it again. But actually, as a population, we're fairly resilient. I think if we have to go through more lockdowns, we will, with much the same success that we have done already, with more of society carrying on. One of the big questions for me is international travel, and the kind of things that we're unsure about in terms of the medical profession more broadly is how will our conferences look in the future? How will we function as Royal Colleges in the future? And I guess some things will return and some things will be different. How many days a week are office-based workers likely to be in the office for? Now, there are some companies wanting everyone to be in, some companies saying that nobody should be in, and I suspect most companies are going for a hybrid model of people coming in 2 to 3 days a week. But how then do we use face-to-face? If I'm having committee meetings, mostly which can function on electronic means, there seems to be a real desire to have a face-to-face meeting periodically. But then what do I put into the content of that face-to-face meeting periodically to make it different from the electronic meetings and get the most out of the social interaction? So I guess this gets back to a really interesting observation, which is in our modern age, what's the function of that social interaction? And we're missing it, but I'm not sure we fully understand why we're missing it.